Familiar with the company, it's been around quite some time. It is Oslo-based, traded on the Oslo Stock Exchange. We have approximately 71 employees, and that is growing. We'll get into that a little bit later, but it is growing in the U.S., where our greatest commercial opportunity exists today. We do about 21 million in U.S. dollars, at least that's this year. We are direct operations, sales, commercial operations in the Nordics and in the U.S., and we have partners in the rest of the world. We also have a key partner in the cystoscopy device side of the business, Karl Storz for the U.S., and Karl Storz, Olympus, and Wolf that provide the cystoscopes in the rest of the world. Core key products on the market today is Hexvix and Cysview. These are PDDs, photodynamic diagnostics used in the diagnosis and in the treatment of bladder cancer. So investment highlights. I probably would give this a headline of a commercial opportunity. I think if you consider my background, which is heavily commercial and heavily U.S., it might make more sense that I would be leading a Norwegian company since the opportunity lies in the U.S. My experience has been in building, starting up, and growing life science companies, particularly in biotech, device, and drug device. And this product in this organization actually is focused right where I've been, which is drug device. It is a profitable commercial franchise focused on bladder cancer, approximately 30 million in market sales across the globe. As I mentioned, one of our key partners, Ipsen, is in Europe, and so we take a royalty off of that. They pay us, but the rest of it is direct sales for us in the U.S. and the Nordics. We have significant revenue prospects, and I'll talk more about that today, in particular in the U.S., where our penetration rate right now is fairly low, and there's reasons for that. Reimbursement is very key to the U.S. market. So I believe there is a very large untapped potential for Hexvix, our Cysview in the U.S., and Hexvix actually in Europe, where we're working closely with Ipsen as well. We do have a high penetration actually in the Nordics, and so there's other opportunities, and I'll talk about that in a moment. We have a strong competitive position. We are the only blue light cystoscopy diagnostic on the market. So there are no competitors that we're competing against. So that's why you'll hear me use the word penetration and not market share, because it's really about penetration for us and getting every bladder patient that deserves this sort of diagnostic. And then the existing commercial footprint, as I mentioned, direct commercial footprint in the U.S. With over 30 territories in the United States, and then we have direct footprint in the Nordics, Sweden, Denmark, Finland, and Norway, and then our partners in the rest of the world. So the strategic focus is on transforming bladder cancer management. It is an expensive cancer. The key name of the game in bladder cancer is surveillance. If you catch it early, it's treatable. If you miss it, it's not good. So we have basically a four-pronged strategy. We want to increase our penetration in the existing markets, specifically the U.S., but we also have opportunities in Europe as well. In the U.S., penetration is somewhere in around 5%. In the Nordics, our penetration rate is somewhere between, depending on which country, 30 to 70%. So you can imagine the untapped potential we have ahead of us. We want to extend the use of blue light cystoscopy in the surveillance market. Up until middle of this year, we were in the U.S. We were only able to access the surgical market, which is a fraction of the larger market, which is surveillance. In the surgical market, we have a couple 100,000 patients potentially being benefited from using blue light cystoscopy. In the surveillance market, it's 4 times that size. It's 1.2 to 1.4 million patients per year to be treated with blue light cystoscopy in the surveillance of bladder cancer. We want to expand into new geographic markets with our partners or directly if there's an opportunity, but the key is that every patient around the world can benefit from the use of our product. And because of our footprint, and we have a direct commercial operations in the U.S. and the Nordics, we see opportunity to expand our portfolio by adding in other products. There are 2 products, wrong button. 2 products that actually we have developed through phase 2 or phase 3 ready, Visonac, which is an acne treatment, and Cevira, which is a cervical disease treatment, which we are looking actively to partner those out to companies who can do a much better job of optimizing those assets. So let's just talk real briefly about bladder cancer. It is the 5th most common cancer in the world. It is about 565,000 surgical procedures in the U.S. and Europe. 200,000 new patients every year are diagnosed with bladder cancer. Primary precursors, so to speak, for it, smokers and exposure to chemicals, sometimes around industrial areas. So a lot of this bladder cancer is found in large metropolitan areas where there's a lot of industry surrounding it. There are over 2.2 million cystoscopies in the US and the EU. And again, as I mentioned, blue light cystoscopy can be used in most of those. The average patient undergoes 8 cystoscopies after they're diagnosed with cancer in the first 2 years. So they're coming in for continual surveillance and for the rest of their lives, in fact. It has a 10 to 30% progression rate. It's very expensive and accounts for about $3.7 billion in direct medical costs per year. So what is Cysview and Hexvix and how does it work? So as I mentioned, we partner with Karl Storz, Wolf, and Olympus. They provide the blue light cystoscopies. Current standard of care is blue light. Under blue light, oops, I keep pressing the wrong button, I apologize. Under blue light, this is what a urologist would see. It looks cancer-free. Under white light, I'm sorry. Under white light, this is what a typical standard of care would have seen. Using Hexvix Cysview, which is preferentially absorbed by the tumor, they see the cancer after using blue light cystoscopy. And what does this mean? The benefits are very clear. 21% of recurrent patients were only found with Cysview. As I mentioned, the game in the game here is surveillance and early treatment. 21% of them benefited from using Cysview and blue light cystoscopy. 16% found additional TA or T1 stage cancer. And 35% of the patients, which is quite remarkable, were found with carcinoma in situ, which were only found with blue light cystoscopy, and that is one of the more aggressive versions. So detection of more bladder cancer, better staging, you get better, more optimal surgical results, accurate staging of the cancers, improved long-term management. And I think the key here is, while we see it, and you're seeing it today, so do all the major guidelines across the world. AUA, EUA, SUO, there's a whole host of them that now believe in blue light cystoscopy, and they actually have a very good prominent position on many of these guidelines. And the cancer guidelines are also extremely important, as the national guidelines are often translated into the local guidelines at the local hospital level. We're in many of the major hospitals and institutions. We sort of have a reference center mentality or strategy where we're going into the majors. These are the guys who set the tone for the rest of the nation, particularly in the US. We're in 74% of the NCCN designated cancer centers, 39 of the NCI designated centers, and 74% of the 25 largest adult urology centers in the US. As I mentioned, we're including all the major national guidelines at level B, which is a very prominent position on these guidelines. It is basically saying that if blue light is available, it should be used. Our strategy is very clear. It's focusing on the larger MSAs. As I mentioned earlier, there are around 200,000, 300,000 surgical procedures, 1.2 million now surveillance procedures that are available for us to go after. If you translate it, the wrong button, I apologize. If you translate that into US dollars, it's about 770 million US dollars just in the top 25 MSAs in the US. What's really key about this is we've been out in the market for several years. We've installed a lot of cystoscopes. We already have a set base, and we're going after that same base for flexible cystoscopy to catch the patients outside of the surgical suites. We've also increased our investment in the commercial operations of the US by threefold. So a lot of the investments we expect returns to come over the current year and in future years. In the Nordics, as I mentioned, we have a very high penetration rate, depending on which country, 30 to 70% penetration. So what opportunities lie for us with these countries is still there. In Sweden and Finland, in Norway, we still have room to grow. In Denmark, we actually have a very high penetration, but what we have done is, as I mentioned in our strategy, is we found a partner in Combat Medical, and we've been able to add a product into the base of the reps who are calling on the same doctors in the same places, and we're able to drive additional revenue out of those territories. And that has just begun, and that'll start carrying on into 2019. In the partner side, we actually had a slight dip in performance. We've been working very closely, particularly with Ipsen, and they've actually had a rebound in quarter 3, and we continue to work very closely with our partner in trying to improve the penetration rates in the rest of the world. And even in the Nordics, I should mention, we still have a 14% growth rate. I mentioned the opportunities in the other countries. So from a core financial perspective, we have about $11 million in cash on hand, plenty of money to continue investing and growing the business. We've had very strong revenue growth at 45% year over year. I don't see that ending anytime soon. There's tremendous opportunities. I mentioned the penetration is really low in the U.S. The key things that have happened for us in the U.S., we've gotten reimbursement in our favor. That actually is permanent starting in 2019. And for those familiar with the U.S. market, that is the holy grail, is to get access to the patient base. We're up 14% on the Nordics, 9% in constant currencies. We have a slight increase in operating expenses, and that's due to the investments we continue to make in particularly the U.S. market. Our development portfolio, we've reduced and don't have a need for continued R&D, so it's very limited, so we've been able to reduce our cost base there. And as I mentioned, our cash position is $11 million, and our net cash flow out was about $700,000 last year. This year. So what are the growth drivers? What's the outlook? We've expanded the U.S. team where the greatest opportunity exists. As I mentioned, there are about 300,000 surgical procedures and 1.2 to 1.4 million surveillance procedures that could benefit from Cysview in blue light cystoscopy. We've been included in all the major guidelines, AUA, NCCN, EAU, NICE in Europe, and ICUD. We have permanent and favorable reimbursement in the U.S. with a permanent A code and additional coding. We've expanded indications in the early detection of the surveillance market, which is access to the 1.2 to 1.4 million additional patients. And we currently have a 43% growth year over year in the installed base of rigid and flex cystoscopes, and these are the scopes that are used to view the blue light cystoscopies. We reiterate a strong outlook for the U.S. Significant opportunities exist. We intend to update everyone on our outlooks, latest at the end of this year as we give our 2018 results. And that's it. Questions?
Thank you. We have one question.
Yes.
On that.
What's the status of the out-licensing and what's the potential?
The potential is very good, and it is still active. I don't have any specific update to give you, but there are interested parties we've been talking to.
Put a dollar figure on the potential?
I'd rather not at this time since I haven't done it yet. It all depends on the deal and the structure of the deal itself, but when we do, we will let that be known to everyone. Okay.
I have another question.
Yes.
Here.
A little bit of follow-up to that question. Before you stated that Cevira and desember was subject to consideration of strategic alternatives, but now we have decided to partner it out, if I understand you right.
Well, partner or strategic alternatives, yes. It's just we will not personally commercialize, take it through phase 3, and then commercialize it. It's not our core, as we've now focused in on bladder cancer in urology. Yeah, so we're finding a partner or a strategic alternative that would do a much better job and optimize the asset, better return for us as well. Yeah.
Good. And could I also ask you to talk about Karl Storch, Olympus, and Wolf? But in the US, if I remember correctly, it's only allowed to use Karl Storch's cystoscope. Can you do anything to change that?
Yeah, so Karl Storch was the cystoscope that we used in our phase 3 trials, and that is the cystoscope that we're allowed to use in the U.S. Our indication is with Karl Storch. We are investigating other opportunities with Olympus and also with Wolf. Right now we're in an arrangement with Karl Storch, but there's always opportunity, and that's one of my key priorities as we go into 2019.
So if you have a 5% penetration on the US market today, at what level, I mean, if you raise sort of the outlook for, say, the next 5 years or something like that, what level would you be satisfied with of penetration?
American, we're never satisfied.
100% then.
Yeah, sure. No, I think that'd be unreasonable. I think, when you look at the Nordics, I think once you approach, and I'm not saying the US would ever get quite there, but if you approach a 70% penetration rate in any sort of treatment, you're extremely high. I think that's generally the ceiling. There's not a whole lot. There's always reasons why the other 30% won't get a certain treatment. My aim is to actually drive it as high as I can. So my goal would be to get to 70%. Whether that's realistic or not, we have to look at that a little deeper. As I said, I'm new in the position and looking at a lot of things. So, but certainly where we're at today is not acceptable. But it's there because of the reimbursement we've had, I think, primarily, and also I think up until the middle of 2018, we didn't have quite the commercial firepower that we do today. So we're ready to take advantage of it.
I know that I've asked this question before, but now when you have permanent reimbursement, have you seen an uptick in the users that actually already have co-stars?
We expect that this will become more important in 2019 when it actually goes into effect. But what should happen is that physicians are more confident now that they're going to get the reimbursement, they're going to get paid for the procedures. Up until this point, we're working off temporary codes or things of that sort. It creates some level of uncertainty. Physicians, are obviously putting money out to do these procedures in time, and they tend to maybe shy away from it. But now with permanent, we would expect that this would help. Yeah.
And last question for me. If you think about the surveillance market and given the limited number of blue light cystoscopes from cold stores, how will you go about getting the penetration of sort of the right cystoscope out there to be able to really address the surveillance market since that's so much bigger?
Yeah. So, the good news is that we already have an established basis of 130 plus rigid scopes out in the marketplace today. Those accounts are some of the major MSAs, and I mentioned earlier, NCI designated hospitals, key institutions that are treating with blue light cystoscopy in the surgical suite. Those are our low-hanging fruit. These are physicians, urologists who already believe in it, believe they can see more. So we believe we can penetrate those markets fairly quickly with flex scopes. However, there's tremendous opportunity with as many urologists that practice out in the office space, and so we are obviously going after those physicians as well. It's still an investment. It is an investment from the physicians, an investment from a hospital to bring these scopes in. But we believe the benefits outweigh the cost. Certainly, if you do the math from a hospital's perspective, economically, it doesn't take a whole lot of patients to pay the scope off and actually have an economic positive.
Okay, great. I think that was all from me. No, we have a few more.
Okay.
Down there.
Just wonder, when you're having your positive cash flow, are you planning to pay dividends?
We're still in investment stage. As you can see, the opportunity is tremendous. So our intention right now is to generate cash, invest our cash back into the business where we think we get a greater return. I have not given any guidance on profitability or future dividends at this point, but I think we're at an investment stage at this point. It makes a lot of sense to continue to optimize what we have in front of us.
Another question?
Yeah.
I would say that Photocure is in a turnaround situation, a very good one, with new possibilities with remuneration. And I have a couple of questions. The first is the patent situation.
Yeah.
I don't know if you know anything about that. And second, drug device rights in US, I think they have some possibilities to postpone or to increase the rights in the market. Do you know anything about that?
Well, the patent, and then I'll have to ask you to clarify the second question a little bit because I don't quite understand. But the first one on the patents is we have done a lot in the patent work. We've actually even done, in addition to the patent work, we've also continued to do competitive surveillance around the world to see if anyone is even interested in joining it or entering into this marketplace. And we just recently had a report we do not have anyone in the near horizon, and near being several years at least. From a patent perspective, we have added and we continue to look at ways to shore up our patents, and we continue to file. Our intention is to continue to protect our asset. And the second question?
It was drug device rights. I mean, you have market I think that in US you have market rights
Yeah.
when you get an approval for a combination of drug and device.
Yes.
Do you know anything about that for cure, for surveillance mostly? I think it's a 3-year right you can get, but
Oh, yeah. Well, I know a little bit about it. So we do have a 3-year extension on our patent, well, on surveillance, correct? If that's your question, yes. Yes, yes. And so that began on the approval in the middle of this year. So we have 3 years of protection on the data exclusivity with those combinations, correct? Okay. Sorry about that, I didn't understand first.
Okay, great. Thank you very much, Daniel. And